Okay, and let me share first my slide before we are starting with the case studies for today. Okay, can you see my slides? Okay.
Yes.
Yes, yes.
Okay, perfect. So welcome everyone. This is the first meeting and actually the first time that we are running this working group. We call it the FOH Activators. Our meeting today will be 60 minutes. I will give you a first 5 minutes of introduction of what exactly FOH, what we are doing. And then I will forward the baton to Gary Kaplan. He will introduce the workforce topic, and he's actually the chair of this work group meeting. We have 2 case studies presenting today, one from Israel, from Sheba Medical Center, and from Singapore, from Sing Health. We will have later interactive discussion and some closing remarks. So let me start talking a little bit about FOH, Future of Health. It's actually started in 2018. And at first we talked only about the future hospitals. It was a collaboration between Sheba Medical Center and the Federation of American Hospitals. And for about 3 years, we spoke only about the future of health. And then we realized that it's not enough just to talk about the future hospital, and we changed it into the future of health. The vision of the community is we are a community of leaders from the world's premier health organization with an objective to influence, transform, and redesign the future of health. We intended to utilize the shared belief of our members and the power of the professional collective wisdom to impact the course of global health. The goals of FOH is actually to create a shared vision for the advancement of healthcare and care delivery by 2030 and beyond. So we are not really looking very far into the future, but in a year or two, we will change it into 2035. So we are looking like 5-10 years ahead. Also, to develop strategies for healthcare organizations to meet the expectations and demands for the shared vision, and to facilitate collaboration between FOH members to achieve the shared vision. You can see that we have diversity of different organizations. We have payers, we have providers, policymakers, academia, a little bit from the industry, pharma and medical device, patient advocacy association, and we also have representatives for 14 different countries. We have from the US, Canada, Australia, Bahrain, Singapore, Israel, and European countries from the UK, Denmark, Sweden, and Germany. You can see here, this is the picture from last year from the annual summit. And this is some of the topics that we already discussed. Usually in the major activity of FOH is the research part. Every year we choose 2 to 3 topics, and we create interesting discussion during the year. And then in the summit, we use the Delphi method in order to create ranking and voting to reach consensus on those topics that we have discussed. So you can see we spoke about equitable access to healthcare and scaling adoption of innovation, healthcare without an address. We spoke already about healthcare workforce of the future, and I will let Gary to jump into in a few minutes. But I think that the idea of FOH activators is to choose one of the topics that we already discussed on the research level and to show real world case studies, what we are actually doing in our organization. And the research topic for 2024 that we have actually just started to work on those topics 2 weeks ago is the emerging and future health professions and patient safety. And Gary, I'm moving to you.
Thanks, Ornit, and let me add my welcome to all of you. Thanks for engaging in this very first FOH Activators group. What this is really about, as Ornita said, is how do we take our learning community and translate it into action, into actual practical, real-world impact. And how do we learn from each other? And so today we're going to have two case presentations. And as this group further evolves, our hope is that we'll hear from all of the participants and all of those who are working to ensure that that we all have the workforce we need for the future. To go back to the objectives of the activators, as R&E mentioned, to enhance understanding, to strengthen our relationships with each other, and again, to translate that into actionable insights that we can actually spread and scale and further innovate so that we are really benefiting from this very innovative partnership that's been created now with FOH over the last almost 6 years. I've been privileged to be part of FOH since the beginning and currently serve on the board of FOH. The activator concept you can see here on this slide, our thinking is that we will meet every other month, that we will have very tight agendas so that we make the best use of all of our time because everybody's busy and some people had to get up in the middle of the night. It'll be our turn in the United States probably next time. And so we want to make the most of our time together. We'll include a 15-minute our thinking now is, and obviously this can evolve as we go forward, but 2 15-minute presentations and then a guided discussion where we can really dig in, perhaps get even deeper into the topics shared by our colleagues. We will end the meeting or come out of the meeting with a summary that can be shared more broadly across the entire FOH community beyond just this activators work group. And we'll have it available on the FOH website. The next slide. So as already mentioned, in 2021, we identified the workforce as an FOH priority, and it was really the subject of extensive research during that calendar year, along with others. I was fortunate to co-chair the working group and to help to develop a position paper on developing the workforce of the future. And we've distributed that. Is that correct, Orny? That's been sent out to people. So you see what actually came of that research and how we put it into the literature, understanding that we have a long ways to go. What's interesting is although this was emerged as the highest priority topic in 2021, in the middle of the pandemic, not surprising, it remains or the top challenge for healthcare organizations around the world. We have a universal talent shortage. We are still dealing with burnout. Post-pandemic, the world has changed with both the expectation and needs of organizations, but also the expectation of the workforce. We are changing venues of care, and today we'll hear about the innovative work at Sing Health on their home hospital work. And we're developing new ways of working, like hybrid and remote working. And so there's many, many things that continue to shape this discussion today. The research showed us, as you saw in the paper, several areas of consensus. There was consensus of the participants on the impact of technology, the changing roles of the workforce, the changes to the organizations themselves, and the economic pressure around labor costs. And we were aligned around the opportunity to create significant efficiencies. There were concerns expressed about what technology would do to particularly the physician-patient interaction, but also daily work life in our organizations, what's going to really happen to the professions, how will we manage resistance to change, which, as we all know in healthcare, never goes away. Healthcare is not the most change engaging profession. So how do we as leaders help that? And then how do we embrace the change in our organizations, understand the satisfiers and dissatisfiers, and work to mitigate the dissatisfiers and build up increasingly the satisfiers in work. So we're excited for the two presentations today. We know that we're going to start with Sheba, and we know that culture is critically important. We can make point changes in organizations and in our ways of working, but unless we understand and address culture, we're not going to be able to transform our organizations and create optimal places to work and build careers, and most importantly, and very much connected to the workforce, how do we ensure the very best places for our patients to receive care? So I'm excited to hear, as I know you are, the work of our colleagues at Sheba, and we'll start with this presentation. We'll then move quickly to our presentations from Sing Health, and then we'll have plenty of time for discussion. So
I'm taking.
We'll go forward.
Thank you very much. I'm happy to be with you in this evening, Israeli time. First of all, let me introduce myself. My name is Avi Baruch. I am the Deputy General Director for Management and Human Resources in the Sheba Medical Center. And in the next minutes, we will give you a short brief about our organizational culture, which help us to achieve our goals. With me is Shirley. She's my deputy. Shirley say hi.
Hi.
She's my deputy, and she will help me during the presentation. Before diving, let me speak a few words about the Sheba Medical Center. Sheba Medical Center is, as we call it, Israeli City of Health, is the largest, most comprehensive healthcare facility in the Middle East, and especially in Israel. And we are one of the 10 hospitals in the world at the last 4 years, one of the top 10, hospitals according to Newsweek magazine. In Sheba Medical Center, there is 6 hospitals: the General Hospital, Gynecology Center, Pediatric Hospital, Oncology Hospital, Rehabilitation Hospital, and Sheba Beyond is the new hospital that was established during the pandemic. This is the remote care hospital. We have in Sheba 10,000 employees, and among them 1,700 physicians, and we are doing the most we can to give help to the Israel citizens. I can't talk about the culture without mention the October 7 from our perspective.
Avi, maybe you want to move to the next slide. We are still seeing the entire slide, so maybe you need to reshare again the presentation and put it on a presentation mode.
Okay, sorry. You're here?
We are still seeing not in a presentation mode, but if you could jump to the second slide, maybe it will.
You see the slide Sheba by the numbers?
No,
No.
we see the first slide.
Okay. So let me write again.
Okay.
Okay.
Now it's perfect.
Okay, so I was here, I spoke about the 6 hospitals, I spoke about the 10,000 employees, I spoke about the 1,700 physicians, and all I'm trying to say that we are trying to do the best we can to give health to the Israel citizens, and by doing so, we are building a culture. I can't talk about the culture without mentioning the October 7th from our perspective, and I want to take you back to the 7th October around 6 a.m. It was a massive, wide-ranging surprise attack on Israel that was launched by the terror organization named Hamas. The surprise attack began with a massive barrage of thousands of rockets fired into widespread areas across Israel. At the same time, approximately 4,000 terrorists entered Israel by land, air, and sea. They launched attacks to the control of the IDF bases and positions, while simultaneously invading civilian communities across the line border, occupying them, murdered children, women, and old people, burned houses, and abducting civilians. In this attack, approximately over 1,000 people were murdered and 2,000 were injured. It was the greatest tragedy for the Jewish people since the Holocaust, and especially since the establishing of the State of Israel. In these chaotic hours, with the missiles firing, terrorists on the streets, and horrific images of emerging in the media, many did not know the fate of their loved ones, yet around 4,000 Sheba staff members left their homes and families, mostly even without being called in, and made their way to the hospital. Despite the difficulties and the uncertainty, our staff from the most junior and senior levels reported for duty at Sheba. This demonstrates the power of our organizational culture, even in time of extreme challenge, with a natural instinct to remain home with the family. Our team came together, united by common mission to save life. So, how do we build this organizational culture? We first of all defining the vision. Sheba's vision statement established is the health city of Israel, a leading global medical center that puts patient first and has a national and international impact. We inspiring change. The vision inspires Sheba employees to seek ways to transform the face of medicine, and always ask, how can we do this different and better? This leads to drive innovation, and the vision and the inspiring for changes help us create a sense of purpose and culture of excellence.
So how do we do it? How do we take this vision and break it down to action items that we as HR can implement in the organization? First, we realize that if we want to put our staff to put the patient in the center, we must put our staff in the center and give them the comprehensive support that they need. If it includes housing assistance or consulting services, and even healthy lifestyle programs, including gym membership, all of which in order to take care of their overall well-being. And also in the journey of the employee's life, we want him to feel that we are walking beside him. In every significant event of his life, the happy ones, if he's just celebrating a birthday or he had a child, or even in the challenging moments, if he's sick or grieving, we're here, we're beside him. And we want to make him feel that he's an integral part of our team all the time. And in order to achieve our goal, we must empower our employees. We need to invest in their development, enabling them internal mobility inside of Sheba, and giving them the platform to exercise their initiatives. Also, we found out that our employees are seeking to feel a part of the community. Even in a large organization, they want to have shared experiences. So we established symbolic events, gatherings, if it's to toast together for the new year or welcome a new manager to the role or saying goodbye to a manager that is retiring. We want this event to be together and shared a feeling of the community. Next slide, please. But seeing only the employee is not enough. We need to see the employee as a whole and to see his entire world. And that's why we established Sheba Family. As Avi mentioned, we have over 10,000 employees. So this is not an easy task to create a feeling of family atmosphere in this size for organization. But we did so by offering academic scholarships for employees' children, providing employment opportunities for employees' children with disabilities. This project is really so moving that I could talk about it for an hour, but it's for another time. And also during the pandemic, we found out the importance of a computer for every child, if it's for studying or for communication. So we started a program giving employees that can provide their children with computers from Sheba. And also encouraging work-life balance. This is a very challenging issue, but we are inspiring and encouraging our employees for that kind of balance.
Last but not least, the management have an important role in building this organizational culture by leadership, by example. Visible presence. Sheba leaders actively engage without frontline staff through informal meetings and by being present on the hospital floors all over the days, 24 hours a day. Accessible and responsive. Sheba leadership teams makes themselves readily available to address employees' concerns and provide timely feedback. And at last, Sheba leaders model the value they expect from their team, inspiring culture of excellence. In conclusion, employee experience matters. A positive caregiver experience directly translates into a superior patient care and outcomes. Holistic support, addressing the word employee from professional development to family needs, creates a culture of belonging and fulfillment. And the X factor is the Sheba attract and retain top talents in a competitive landscape. Thank you.
Thank you very much to you both. That was excellent, and I think we'll certainly have some input and conversation about the things you've discussed. It's quite inspiring. Let's move on to our second presentation from our colleagues at Sing Health in Singapore, mobile inpatient care, and we'll turn it over to the Sing Health team.
Hi everyone, can you hear me?
Yes.
Okay.
Yeah.
Hi, this is Wei Wei from Singapore, specifically SingHealth. Thank you for the opportunity to share our case study on mobile inpatient care at home. It's midnight here, so I'm feeling quite energetic. With me, I also have Dr. Lee Chien En, who is the sponsor for this project. My fellow co-lead, Dr. Michael Wong, besides Esther and Incock, who are already part of the Activators group. And I also have Shiya here, who's helping me to share the slides. Next slide, please. So just before I go into the problem, just a very brief overview of SingHealth. SingHealth is the largest public healthcare cluster in Singapore, and we are responsible for delivering almost half of the public healthcare delivery. We offer the full continuum of care through a network of acute hospitals, community hospitals, large primary care clinics, and national specialty centers. In terms of the statistics, we actually see about 250,000 hospital admissions with over 1.3 million patient days every year. So coming to the problem we are trying to solve here, Singapore, similar to many other countries, faces a very tight bed situation in our public healthcare hospitals. With an aging population and more patients having chronic complex diseases, we are seeing a pent-up demand of patients' attendances, and this increasing workload spills over into the ED when there's not enough beds to admit the patients. So this increasing bed demand, tight bed situation actually directly impacts our manpower, leading to manpower crunch, burnout, attrition, basically poor morale. So to keep building new hospitals, new public hospitals in land scarce Singapore is really not sustainable. Land comes at a premium, and even more scarce and precious is our trained manpower. Next slide. So there was interest to look into substitutes of inpatient model of care. The concept of MIC at home is not new. I think in some of your countries, it's probably called virtual wards or hospital at home. This is really the concept that allows patients to receive hospital level care at home. And in turn, this moves out patients into the community to be cared for, preserves inpatient capacity for higher acuity cases, and thus alleviate our bed crunch. So very briefly, how this works. So we recruit patients from various touch points, including ED, SOCs, as well as the inpatient wards. And after admission, they have access, 24-hour access to care team. And they're being seen on a daily basis, either through teleconsults or home visits. The typical length of stay is up to 7 days. And this service is currently available at all the 4 public hospitals at SingHealth, CGH at home, SGH at home, SKH at home, as well as KKH at home. Next slide. So we do this not by ourselves, but actually with multiple stakeholders. First, we have the Ministry of Health as well as national level agency, MOH Office for Healthcare Transformation, that set the national policies and also funded the initial pilots. We have other national level agencies looking at the IT procurement aspects, including logistics like home delivery. For the actual service, the hospitals and classes run the service, but we also work very closely and we engage our trusted third-party providers, such as home care providers, to help us seamlessly care for the patients during after office hours, weekends. So this sandbox or this pilot was initially piloted at just a few sites. But because of the success, actually this propelled the ministry to actually mainstream this service, meaning that it's given government subsidies as well as healthcare insurance coverage from April this year. Next slide. So I will talk a little bit about the technology and the tech solutions that we deployed under this model of care. They are really critical for us to be able to safely monitor the patients remotely. So the remote clinical monitoring solution firstly helps to free up the nurses' time. They don't have to call up the patients to obtain the vital signs readings. Secondly, it also empowers patients to be also involved in their care. And the further integration of Bluetooth-enabled RCM devices reduces the need for the patients to submit the readings manually. So for the video consultations, this is a modality that obviously allows visual assessment during clinical review and allows the care team to do this safely and also be able to continue to communicate with the patients effectively. Next slide. So I just wanted to share a little bit more about the remote clinical monitoring solution. This is actually developed by ourselves together with a national tech agency. And the interesting thing about this is actually it originated as a solution that was used during the pandemic in the COVID community facilities. And thereafter, we actually pivoted it for use in the COVID virtual wards and now MIC at home. So this solution have a few aspects. One is the chatbot, either through Telegram or WhatsApp for the patient education and engagement. And secondly, it allows the patients also to submit the readings. And thirdly, there's a back-end dashboard for care providers. So I mentioned earlier that we engaged third-party providers to augment the care delivery, and these third-party providers also have access to the dashboard for the monitoring. Next slide. So this is a slide that shows the statistics and outcomes. So you can see without MIC at home, definitely we will have a lot of problem with our bids. And of course, that will also lead to a lot more stress to the workforce. Next slide. So this is a few articles that our mainstream media actually mentioned our model of care. And you can see that some of them even position hospital at home, our model of care as a norm, home hospitalizations as a norm. And of course, definitely we welcome this publicity. It helps in patient acceptance and also provider acceptance. And there are many positive feedbacks that have been featured as well. Next slide. And this is our vision for what we call the Phygital Sing Health, which is really about bridging the digital and physical healthcare delivery. And you can see here that there are many initiatives, not just MIC at home, that comes under the umbrella of Sing Health at home. Next slide. And as we move into the digital first healthcare, we are really trying to transform ourselves basically to deliver care better for our patients. So whether it is the inpatient care, whether it's outpatient care, emergency care, as long as it touches the patient journey. Next slide. So to sum up, there are two key learning and insights that we wanted to share, which we felt were critical in the success of MIC at home. The first is the need for working tech, i.e. Common digital platforms, for providers to enable the scaling at pace. And secondly, is more a culture piece, which really is to embrace the iterative nature of transformation, innovation. I think similar to what Weber mentioned, really to do things in a different way, to do things in a better way, including change management. So what we have done in terms of pivoting Dr. COVID into Dr. Buddy is an example, and we can now really do this in a way that is seamless, and also it opens up new opportunities for us to engage the patients and also to connect with new partners. Next slide. So really our goal is that with the right model of care, enabled by the right technology, our patients can flow seamlessly, you can see in this diagram, through an integrated health system, even a health social system across settings physically and virtually, to receive the care and the support when and where they need it. So we can safely flow our patients, inpatients back home, relieving bed crunch, hold them at home through our MIC at home model together with our partners, and link them up as necessary with community resources. So with that, I thank you very much for your kind attention. Thanks.
Thank you. Two outstanding presentations, innovation both in the venue of care with home health, and we can only, some of us can only imagine the magnitude of change this represents for the workforce and even for the leadership of an organization. And then hearing about culture and how putting the employees at the center is critical to developing the kind of culture that will be high performing as we're seeing at Sheba. So I hope you've been thinking about some questions. I have a bunch of them prepared if you don't have any, but I suspect there's a lot of things going on in your collective brains, and that we undoubtedly have some questions and food for thought. So let's use the raise your hand function, but I will also be looking at the screen here. Who has the first comment or question? Andy, I see your hand. Thank you.
Thank you, Gary, and thank you to both presenters. That was absolutely terrific. And let me introduce myself first. I'm Andy Ortiz. I'm the Senior VP and Chief Human Resources Officer for Cedars-Sinai here in Los Angeles. So I'm one of the lucky ones. It's, we started at 9 a.m. My time, 9 a.m. in the morning. So thank you to all of you who are here in the middle of the night and making all the extra effort. Very much appreciate that. And I'm sure in the future when I'm presenting, it will be the middle of the night. But I just wanted to, first express gratitude to both organizations for the great effort that they're making in continuing to push us on the patient journey. And I heard loud and clear from both organizations that the patient was at the core of the great work that they've done. The question I would ask each of them is, were there any barriers or resistance that they received from staff or from leadership as the organizations were making their respective changes? So anything that would be helpful around barriers and how you kind of managed those and overcame those would be helpful for at least me to know. So thank you.
Yeah, thank you, Andy. And there's certainly, this represents a lot of change. So it won't be surprising to hear that there were some who weren't all in on day one for the changes. So our Sheba representatives, Aviva, thoughts you want to share? You're on mute, by the way, so we have to unmute Aviva.
Thank you, Andy. Thank you for the question. Well, as you all know, to lead change is very difficult because the people don't like to change. They like every one of us like to do the same things all over, and you have to be very, very courage to do the changes and to implement the changes inside your institute. So it took us at least 6-7 years to do the change, and we are like a big ship. To do change takes very long time. It's 10,000 employees, and to reach every one of them it takes time. So, but we are very strong and we believe our way. So we are doing it step by step, and we achieve our goals by running marathon. I said it's not 100 meters. It's a marathon. It's a big marathon that we are running into, maybe longer than a marathon. But we have to be strong and to believe our mission and our goals, and the combination between the patient and the employees. That the way this is the way we are doing it.
Just a quick follow-up on that, Aviva. Were there any tricks to maintaining the focus? Because for things that I've found that take, 6, 7 years, and I totally understand how this takes time to change a culture. Often leaders and others get distracted. They start chasing other things and lose the focus. Any comments on that? Aviva or Shirley, any comments on how you maintain the focus over 6 or 7 years?
Yes, because I think that we talked about the staff shortage. I mean, our management is well aware that this is our biggest challenge. If we don't have the best physicians, if we don't have nurses, if we don't have the best human resource that we can have, we won't be top 10. So in understanding that the investing in our human capital is exactly it. It's an investment, and that will help us achieve our goals.
So keeping that front and center is critically important.
Yeah.
Sure. Thank you. How about challenges or barriers from our Sing Health teams?
Yeah, so I would say definitely there were challenges, but I have to say that the pandemic actually got people at least warm to the idea of remote care and remote monitoring. I think before that it was really, really hard to even get any patient to do this model of care. At the beginning, there was also a lot of manual processes, I think, that we needed to overcome. And to do that, we leveraged tech. I would say, start with the people who believe in this model of care, who believe that this model of care will really benefit a certain segment of the population and patients. And, I've seen very moving videos of patients who shared how they have really benefited from this model of care, and how, if they would, have been hospitalized otherwise, especially patients with very little reserve, they would really have deteriorated. Yeah, so I think get the people who are on your side, to champion this with you, and then of course get your teams to do, the clinical governance. We were also very, very fortunate to have, as I mentioned, national level agencies. I think ministry was also spearheading this, leading this, and also, got in the national level agencies for IT, for procurement, to help us with this. Yeah, so the funding and all that, flowed in after mainstreaming as well, and that definitely helps. And of course, MOHT also got the media to feature some of this, real cases. That also helped with the acceptance. Yeah.
Other comments, Chen?
I wonder if Shannon or Michael maybe want to add on as well. Thanks.
Yeah, maybe just to add on, I think as Wei Wei said, we had a burning platform, which is the big crunch that we are facing. And we had the pandemic, which got us, in a sense, used to models of care that were thought of before, but did not really take off. One example is for MIC at home is medication delivery. We already had the service before COVID, but the numbers were very small. But during COVID, when everyone was concerned about coming to the hospital and all those, we delivered the medicine. And we also now have developed the app where you can ask for refills on the app. And it has become a habit. I think 2 years is enough to develop habits, and people are now getting used to it. So from the provider and the user perspective, the pandemic has helped. And the other thing I think that has we have had to address the challenges, I think we mentioned on the technology, because initially we were working as a CGH hospital at home, at Singapore General Hospital at home, Sengkang at home. But now we are working as SingHealth at home because we are creating a common platform so that each hospital do not have to reinvent the wheel in terms of what they do, but instead we can learn from each other. We share our protocols, we share our means of working, and we also then are able to tap on individuals, institutions, innovations, and at the same time to have, in a sense, a more centrally coordinated approach. And what also worked for us was that it's not either or. It's not either digital or physical, but we have both the physical and digital fully integrated. Because even out in the community, we have our own community nurses, we have our primary care providers, we have our community partners that work as what we call in teams that will the support services. So this ensures that, as Gary earlier said, with technology, does it affect the human touch? So that ensures that the human touch is there. When we need, let's say, to do a procedure or someone to pay a visit, a coming presence that could not be addressed on a tablet or a Zoom call, we have people that can do it either ourselves or through our partners. So it's working, as we will say, starting from those who are very committed, and then working in expanding circles, and then adding more and more people to create a movement rather than just a program. Thanks.
That's very helpful. Thank you. I heard a couple things just worth highlighting. One was the old saying that a crisis is a terrible thing to waste. With COVID and the pandemic, we tried things. We had to, of necessity. And I think, I know in my organization, Virginia Mason, we were sort of just dabbling in telehealth and video visits. But once the pandemic was upon us, we were set up at scale within 10 days. And leveraging that now post-pandemic, as you've done, that's really important. The other thing I heard that Han brought up was appealing to the heart. The stories, the making visible the emotional benefits to families of having their loved ones at home, and making that visible. I think we all went into healthcare because we wanted to help people and make a difference in their lives. And I think making that visible really helps deal with resistance as that occurs. Just a couple thoughts. Callie, you have comments?
Yeah, first and foremost, thank you for inviting me today. Callie Dretke, I'm the Chief Marketing, Chief Digital Officer for the College of Healthcare Information Management Executives at Chime here, US-based. I share a lot of sentiments with Andy, just in utmost respect and thankfulness for the comments and the presentations made today. It was fantastic. And one of the pieces that I was thinking about as I was hearing both of your presentations, different is, Gary, to your point, it was this central component of people, right? It was people are the center of everything we're doing. And my question is, as we look at people and we look at some of the changes that are coming in the demographics of our various populations, there's a vast generational shift that's happening, right? So with the US-based, with the retirement coming of the baby boomer generation in the next 5 years, I was just wondering, for both of your individual organizations, how do you envision this demographic shift impacting both your organizational culture, so specifically over to the partners over at Sheba, And then how do you see it affecting the scalability and effectiveness of these new care models that we heard from Sing Health? So kind of taking the generation and aspect in both of your presentations. I'd love to get your thoughts.
Well, if I understand what you are saying, we encourage our people to think different. Our vision is to change the path of the medicine in the world. And the reason is that we understand that we cannot do the same things because of the age of the population, because we are more and more, and because of all this, we think that we have to change the way we think about how to give care for people. This is the innovation and the transformation that we are trying to do with the FOH and with our ARC department in Sheba Medical Center.
So does the demographics of the changing demographics of the workforce influence that? I mean, we've got the aging of the population, but we also have more younger. Last time I looked, we had what some people would consider 4 or 5 different generations in our workforce. Any thoughts on that as well? From our Sing Health colleagues on Kali's question?
Yeah, thank you for the question. I am actually quite optimistic about the baby boomers generation. I think they've been through a lot, so change is like a constant for them. I wonder whether Esther, who's our group, HR would also want to comment, because I think she would also have seen the changing demographics in our workforce, and how that can actually be a positive, the diversity and all that. Esther. Yeah.
Thanks, Wei Wei. Hi, everyone. I'm Esther from Sing Health. I'm the Group Chief Human Resource Officer. It's midnight here, so trying to think clearly. So in Singapore, we also, in Sing Health, we see aging population, our staff aging, and we also see the newer generation, just like Kelly is saying. We have so what we do, we have the younger generation coming on board. So we also have the reverse kind of mentoring and coaching, where we have the younger coaching maybe the older people on technology and stuff. And we do a lot of job redesign. With with changes, with transformation, we're doing a lot of transformation, especially in the Weiwei's department. With all the healthcare transformation, some jobs will change. Also with the aging population, some of the jobs will change. So we redesign our roles, and we reskill, upskill, multi-skill our staff so that they can take on different roles. And we also have, because with the aging population, we have re-employment. So our staff work, some of our staff as old as 70 over years old. So they continue to work for us, but in different roles when they move to the different phases of their life. And we find that very helpful. So they perform roles that are most suited for them, for each of the staff population.
Yeah, if I may add, from the demographic perspective, from the services perspective, as Wei says, we are quite optimistic because the new old are much more digital savvy than our current old, and therefore we think the adoption of technology will improve and increase as it goes on. But the demographics does give us a certain challenge because we are now having much smaller families, and as our population gets older, for care at home, the lack of a caregiver, a suitable caregiver, is a constraint. And because you may have someone in their 90s and their caregiver is actually in their 70s or 60s, and there are things that they can't do, or they may not even have a caregiver. So in a hospital, we can bathe them, we can feed them, but who's going to do all these things for them when they are at home? So this is where we have to open our minds to explore creative alternatives as to how can we expand our workforce, so that it may not be people that we employ, but it may be by our community partners. And some of our community partners are working on concepts like micro jobs for key areas to work, so that they can. So these are, in a sense, the extenders that could work out in the community, whether it's delivering the food or some task that could be done. And also, as our elderly generation get more educated, they can actually do more in terms of supporting each other. So those are things that we are working on. And we also find that digital allows our older folks to actually have a longer productivity, because they are not so limited anymore, our staff, by their ability to how far they can walk or how heavy they can carry. But as long as they can sit in front of a screen and they can empathize, they can advise, that I think also increases the productivity and also their longevity in terms of their ability to work. That's why we are keen for this, because previously we have always said administrative staff can work from home, but clinicians can also work from home.
Thank you. Thanks to all of you. This was a really great discussion. We are going to do our best in these sessions going forward to start on time and to finish on time, both to respect your busy schedules, but also your need for work-life balance and adequate sleep. But I think the first meeting was I think very good, very exciting. I hope you found it worthwhile. We had two excellent presentations. One of the things that I reflect on is, and I think speaks to the power and the value of FOH, is that we live in different countries, we have different cultures, we have different governmental systems and healthcare payer systems, but we have the same problems, we have the same challenges, and we have many, many of the same opportunities. And so this activators group is going to keep drilling down on workforce. We're going to talk about the competition for talent. We'll talk about resource efficiency and how we use technology to our benefit. We just scratched the surface in talking about the demographics of the workforce and change management and all of those challenges. But we're going to do all of these things building on your experiences and your case studies. We expect there will be more attendees. There'll be continued participation and diversification from the broader FOH membership. We were asking every organization to identify their key people leadership, HR leadership. And so I'm very excited about what we're going to be able to do to kind of hopefully move the dial and have all of us benefit from the experiences of those in this group. So we want your feedback. We hope this approach, this model that we've taken is working. We'll get better at it over time and make sure we stick to our timelines and have good discussion. Please send your feedback to Oranit. I want to thank Oranit and the FOH team for managing all the logistics and getting once we're off the ground, it becomes much easier. And so we are all pioneers within the FOH community now for getting this first activators group going. And I'll look forward to our next session in a couple of months. We'll come out very shortly with a date for that session and even more importantly, a time. So thanks to everyone. And we look forward to your feedback and see you all in a couple months, if not before.
Thank you.
Thank you.
Thank you.
Good night.
Thank
And
you.
have a good day.
Thank you.
Thank you.
Thanks.
Thank you. Bye.
Bye.